Hi, this is Dr. Anton from South Africa. Today's video is about intravenous vitamin C and how health workers can apply this incredible life-saving therapy for their sick patients. This video is aimed a little bit more at health workers, so it's going to be a little bit technical, but I know that my regular viewers will enjoy watching it anyway. My personal story with IV vitamin C goes back to 2003. My father at that point in time had about 20% lung capacity left, according to his pulmonologist, and in that year he contracted a pneumonia. Now you can imagine if you have 20% lung capacity left and you get a pneumonia, it's basically, it's virtually a guaranteed deadly illness. The pulmonologist tried a whole series of antibiotics and none of them worked, so it was obviously a viral pneumonia that my dad contracted. And the pulmonologist told my mother to call the children because we're going to have a small window to say goodbye to my father. Thankfully, I had a colleague who was versed in the application of intravenous vitamin C. And he could get me going, and I gave my dad, it was my first drip, it was my dad's first drip, and I gave my dad 25 grams, that's 25,000 milligrams of vitamin C over 50 minutes. The time is very important here because if you use the right timing, you are going to release hydrogen peroxide in the bloodstream that will be very toxic for pathogens. Anyway, long story short, my dad lived another 5 years because he recovered from that pneumonia, and he subsequently had more pneumonias in the last 5 years of his life because he was on oxygen, he was not moving around, but every 3 to 4 months I could give him intravenous vitamin C and see how it works. And subsequently, I have treated other emphysema patients particularly with lung infections, and have seen the efficacy of IV vitamin C. So this video I would like to position as a toolkit to get my health worker friends going as soon as possible to be able to apply this to your patients. The first slide that I've added to this video is about the benefits of vitamin C in the human body. This is oral or intravenous dosages. All of these are important when you're treating your very ill patient with a viral or bacterial infection. So this is relevant for any time of the year, but it's particularly relevant now that we have the COVID-19 virus that's doing the rounds. And you'll see on this list that there are specific weaknesses in COVID-19 or specific things that COVID-19 does that is important, and why vitamin C is important to bring into the fray here. You'll see there that COVID-19 has a sepsis-inducing coagulation abnormality that it causes, and vitamin C goes against that. Some of the doctors in China are reporting that they're also giving heparin to these patients. And then also COVID-19, part of its virulence has to do with the NLRP3 inflammasomes and cytokine storms, and vitamin C is very important to go against that. Let's have a look at some of the important trials with regards to intravenous vitamin C. There's this trial here from Kim et al. Patients, there were 53 patients in this trial with a control group that received the normal treatment for pneumonia. The treatment group received vitamin C 1.5 grams every 6 hours for 4 days. They also received hydrocortisone and thiamine via infusion. And at the end of the trial, the results were that there was definite lower mortality in the treatment group versus the control group, and also the treatment group had definite improvement in their more of an improvement in their radiologic score at day 7 compared to baseline. Then the next one, this is Fowler et al. This is 24 patients with severe sepsis that were given 2 different dosages of IV vitamin C. It was given every 6 hours. They worked out a dose in 24 hours and they gave the appropriate dose every 6 hours. You can see the dosages there from 3.5 grams in 24 hours to 14.5 grams in 24 hours. The bottom line was that the treatment group demonstrated reductions in sequential organ failure assessment, the SOFA score. They had definite reduced inflammatory markers like C-reactive protein, and there was no significant rise in thrombomodulin, which is suggesting attenuation of vascular endothelial injury. The next trial that I would like to highlight is by Nathans et al. This is in patients, in critically ill surgical patients. So quite a large sample here, 595 patients. 301 were randomized to the IV vitamin C group and 294 to standard care. They were given 1 gram IV vitamin C 8 hourly, and the results were that the treatment group had significantly reduced pneumonia risk and death. The next study looks at, this is from Tanaka et al., and they looked at severely burnt patients. Now, there were 37 patients in this trial, and all of them had more than 30% surface burn wounds. The dose that was given here was 66 milligrams per kilogram per hour over 24 hours. Now, on a 70 kilogram person, that works out to about 4.6 grams per hour, which actually builds up to about 110 grams in 24 hours that they gave. And they found that giving the vitamin C significantly reduced the resuscitation fluid volume requirement. There was also not abnormal body weight gain, and there was less wound edema, and there was a reduction in the severity of respiratory dysfunction in this treatment group. We're also receiving reports from Dr. Mao and his team in Shanghai. He is one of the co-authors of the Shanghai Expert Panel Consensus Report on how to treat COVID-19. This is, at this point, only reports that are coming back. They're busy preparing their findings to publish. But so far, we know that they've treated about 50 patients with 10 or 20 grams of IV vitamin C given over an 8 to 10 hour period. That's a per dose. And then they keep on treating for 7 to 10 days. And they are seeing very good clinical results. Some of their severely ill patients, they're even going as high as 50 grams of IV vitamin C over 4 hours, and they're still seeing very good results at these dosages. I would like to say a few things about the contraindications, relative contraindications, precautions for IV vitamin C. The article that you see on this page is a fantastic summary of high dose vitamin C. They're looking specifically at cancer patients in this article, but they're looking at the very high dose spectrum of vitamin C, 75 grams, sometimes even 200 grams. So when we look at contraindications, G6PD deficiency is technically a relative contraindication because it's for very high dose, 75 grams or higher. As a matter of fact, some patients that have drug-induced hemolysis who have G6PD deficiency actually respond very well to vitamin C treatment. So people with G6PD deficiency from the research can tolerate a 1.5 gram per 6 hour dosage. But my advice would be test your patient as soon as you can, just to see do they have G6PD deficiency. High glucose levels, 16.7 millimoles per liter is very high. This patient has other problems that you have to sort out first before you can give the IV vitamin C. And then there are basic precautions. Renal insufficiency is not an absolute contraindication. It's usually for people that are end stage renal failure, and even in those cases, in some studies, patients can still receive a lower dose IV vitamin C, but this is now 0.5 gram, maybe 600 milligrams. So just be aware of that and deal with your patient as an individual. Then there's things like hypercalcemia and oxaluria. In all the research that I've read, there's a very, very low risk for kidney stones with IV vitamin C. And it's not seen regularly. Obviously, the problem becomes different when you start giving regular infusions for your chronic patients, and this is where the metal storage diseases and the iron overload from transfusions comes in. This is now if you're not giving 2 drips a week over the long term. The questions that doctors ask me at this point in time is, where do they start? What dose do they start? It's a difficult question to answer because the dosage ranges in the literature are so wide. But if you look at your critically ill patient, 1.5 to 3 grams every 6 hours, typically for your in-hospital, high care patient or ICU patient, is a good place to start. Some of the doctors listening to this video are going to be seeing patients in their practices or in an out hospital environment. Some of these patients will qualify for a higher dose vitamin C intervention. This could just be for any other viral infection. It doesn't just have to be for COVID-19. And in this patient, you could consider the higher dose, the 25 gram ascorbic acid given over 50 to 60 minutes. This is where you are going to pulse the red blood cells to release hydrogen peroxide and ascorbyl radicals, which will have a deadly effect on viruses and bacteria. The typical formula that we use for this 25 gram vitamin C drip is written there: the Ringer's lactate, the ascorbic acid, the sodium bicarbonate. Just a tip in South Africa, buy your ingredients like the ascorbic acid and the magnesium sulfate from a compound pharmacy. You can just find that it's cheaper doing it like that, and then you can get the rest of your ingredients you can get from your normal distribution pharmacy. I trust that everyone who watched this video found it useful. I'm particularly hoping that my health worker colleagues have enough tools now to actually do something with IV vitamin C that could be life-saving. I want to reiterate something. On one of my slides, I listed a study that was done in cancer patients. Please download that study. It is full of wonderful information on how you can prepare yourself for a particular patient, because obviously we have to individualize this treatment because all patients obviously are different. So I hope that there's enough information in here that you can just get going. Finally, I'm going to add the links to other videos that I've done on COVID-19 in the description below this video. I will also put all the direct links of the studies that I've mentioned in the video. I'm going to add in the description as well. This is Dr. Anton. Thank you for watching this video. Have a good day.